Welcome to Module 3, Developing Supportive Relationships with Mentees. We are first going to talk about the stories about your own experiences you may share with your mentees and best practices for doing so. Sharing your experiences about getting cured for hepatitis C is one of the most important and inspiring things you can do as a peer navigator. Telling your story can help participants understand that they are not alone, that there are people who have experienced similar struggles with having and getting cured for hepatitis C that are living and thriving. Hearing what you went through and how you got through it can inspire people to become motivated and face their fear. However, it's important to note that telling your stories is up to you. You are in control of if and when you share your own experiences with participants. There are many different types of experiences that you may talk about with your participants. This could include what it was like finding out that you had contracted hepatitis C. This could include examples of challenges that you faced while adhering to the cure. You can talk about how you overcame these challenges and what it feels like now to be cured of hepatitis C. When you share your stories, remember that you don't have to share everything about you all in the first time you're meeting with your mentee. Here are some tips for sharing your stories. Be concise. Make it relevant. Be appropriate. Don't give too much information. Share your feelings at the time. You can talk about what helped you and how you got through it. And always remember to make it inspiring. Think of yourself as the hero of your own story. And some things to keep in mind to maybe don't do. So don't try to tell all of your stories in one session. You will be speaking with mentees weekly or more over the course of many weeks. So there's plenty of time to pick and choose which stories are most relevant. You don't always have to make it about you. If a participant is talking about something and you want to share your own experience, make sure that you remind them how this relates to what they're going through. And similarly, don't make it about another topic. If someone wants to talk to you about issues that they're having with adhering, make sure to share your own experiences about adhering and how you overcame those challenges. And lastly, try not to make it depressing. You are there to support your peer, not the other way around. Again, make it inspiring and think of yourself as the hero of your own story because you are. Since you will be interacting with the participants frequently, it's important for us to talk about confidentiality. So what is confidentiality? Confidentiality is the ethical principle or legal right that a physician or other providers, such as yourselves, will hold secret all information relating to a patient unless the patient gives consent permitting disclosure, or in the case of a few things that a participant might say that we will go over in the next couple of slides. In other words, confidentiality is trusting another with information that will not be shared with others. It's about strict privacy or secrecy. All conversations that you have with your mentee over the course of this program are confidential. The content of all conversations must not be shared with anyone outside the study team. It is your responsibility to protect the privacy of your mentee at all times. So this looks like really not sharing the name or any other identifying information, such as address or phone number about your mentee, with anyone outside the study team. Over the next few slides, we're going to go over these questions, so we will understand why confidentiality is so important. We'll go over the things that need to be kept confidential, and we'll talk about what are inappropriate places to discuss patient or participant information. Why is confidentiality so important? There are a few different reasons. One, people need to be able to trust you and the other healthcare providers in this program. People need to feel safe that the information and the stories and experiences that they share are really going to be kept private between you and them. If patients don't trust us, they may drop out of the HCV treatment and not be cured. Also, it's our policy, and there are liability issues for you and the agency. What are things that need to be kept confidential? Some of the most important things include study participation, so even that somebody is participating in this program, somebody's hepatitis C status, whether or not somebody uses substances, the relationship that you have with the patient, so even saying that you are a peer navigator, and importantly, people's phone numbers and addresses. In other words, these important personal information. And where are inappropriate places to discuss participant information? Basically, any place where others can hear that information. So this includes, but not limited to, in hallways and other public places. There are some important instances where you may need to break confidentiality and report the issue to your supervisor. If a participant says that they are going to commit suicide or gives you reason to believe that, you have an obligation to report this to your supervisor. The same is true if a person threatens or tells you that they've actually killed someone or committed homicide. Children and elderly neglect and or abuse must also be reported to your supervisor. You should tell your participants at the beginning of your relationship that these are the only times that you will break confidentiality. It's also important to know that not disclosing HIV status to a sex partner or someone with whom they share needles does not constitute a threat of or actual homicide. It's also important to remember to not take it upon yourself to make a report to proper authorities. Mandated reporting should be bumped up to your program director or coordinator or manager who will ensure that the agency's policy is followed. So when in doubt, talk to your supervisor. So, if a participant says something that needs to be reported, such as revealing a plan to commit suicide, you will report the matter to your supervisor. For example, you would tell your supervisor exactly what the participant said that made you think that they plan to commit suicide. Another important matter for peer navigators is how to set up boundaries with your mentees. What are boundaries? Boundaries are a line that you can't cross. And the reason to establish boundaries is to prevent you from feeling burnout, to prevent misinformation, to prevent liability, and to keep everybody engaged with the program. Some boundaries are non-negotiable. For example, some may be established by our research sites. Others are more personal and may be different from person to person or situation to situation. It is so important for you to talk about boundaries with your mentees. And this is important because you may feel emotionally close with your mentees. You'll be speaking with them at least weekly. You may be exchanging personal information. So it's very easy for you to want to be all things to your mentees. And it's important to know that it's possible for boundary issues to be initiated by both you as the peer navigator and also by the mentee. So in these next few slides, we'll be talking through different ways of setting up boundaries. So here are some examples about how peer navigators may initiate boundary issues. So these are some things that a peer navigator might say that could cause problems down the line. So, for example, call me anytime, day or night, to tell me what happened. Or, you have to tell your partner today that you have hepatitis C. Asking for a hug or criticizing somebody's case manager. These are all potential issues where boundaries could be crossed. Also, mentees may initiate boundary issues. So some examples of that might look like a mentee asking or saying, I'm a little short on cash today, can I borrow $5? Or asking you out on a date, would you like to go to the movies with me sometime? Or remember, you told me that you use medical marijuana, I got some weed if you want to buy some. These are all some examples of potential boundary issues initiated by a mentee. Luckily, there are ways to set up boundaries, and we can do this by actions, words, and thoughts, which we will talk about next. One way to set boundaries is through your actions. So, for example, only make and respond to your phone calls with your mentees during the hours that are between 8 a.m. and 6 p.m. This really sets the boundary that you are not available at all times during the day. Another way to set boundaries is by not giving out medical advice. Instead, connect the mentees with their healthcare provider. Also, romantic or intimate relationships between peer navigators and mentees are prohibited. Not meeting up with your mentees in person and not lending money are also excellent ways to set boundaries through your actions. In addition to actions, you can also set boundaries through your words. So, for example, you can say to your mentee, "What is the best time to call you next week? I'm available Monday through Friday between 8 a.m. and 6 p.m. How about you?" And if somebody says that they need you to reach them at 7 p.m., 8 p.m., 9 p.m., you can just remind them that the only time that you will answer your phone is between those hours. You can also make it really clear what your role is through your words. So, for example, you can say to your mentee, "My role in this program is to support you as you take your medicine. If you have specific questions with your medication, for example, if you're experiencing side effects right now, I'll help you get in touch with your doctor." Lastly, another example is that if somebody needs a ride to the clinic, what you can say with your words are, "I'm unable to give you a ride to the clinic. However, I will connect you with the program coordinator to help set you up with transportation." There are also ways to set boundaries with your own thoughts. So here are some things to remind yourself as you're a peer navigator to maintain your boundaries. So remind yourself that your downtime is important. It's not only okay, but it's necessary for you to take time for yourself. You can also acknowledge that you can't at the same time set a boundary and take care of another's feelings. In that moment, it's important to take care of your own feelings. It's also okay to remember that your mentee will be okay without you. Also, if you want to help your mentee, you need to know that you need to take time to care for yourself first. And lastly, if there's something that you're not comfortable with, it's okay for you to chat with your supervisor for advice about it, for how to set that boundary with your mentee going forward. So what can you do when someone crosses your boundaries? First, inform them. Describe their behavior to them, exactly what they're doing to cross boundaries. Next, request. Let them know what you want. Third, take a stand. Let them know that their behavior is crossing that boundary and is not appreciated or disrespectful. And lastly, consult with your supervisor. Share what is happening with your supervisor and then make the best possible decision for you, your mentee, and your study site. If you don't know what to do, don't do anything until you speak with your supervisor. And because of all of the time and support that you will be giving to your mentee, it's also important that we talk about your own self-care. Remember, you can't support your mentees if you don't get support for yourself. At some point in your job as peer navigator, you may hear a story that causes you to have an emotional response. Maybe somebody's talking about things that depress them, or maybe they're talking about an urge to use drugs that really stands out to you. So here are some steps that you can take when you hear a story that causes you a response. So first, self-awareness. Second, bracketing. And three, debriefing, which we will be talking about next. The first step of self-care is really self-awareness and being able to identify the emotions that you are feeling. So periodically check in with yourself. Ask yourself, what emotions am I feeling? Sometimes it's hard to pinpoint exactly what we're feeling, and it's helpful to look at an image like what we have on the right here of this emotional wheel to be able to identify this emotion. So the first goal here is really to acknowledge all of the things that you are feeling instead of just ignoring them. Because I think we've all experienced that when you only ignore your feelings, sometimes it's hard to be able to control them. Second is bracketing. Bracketing is a process where a person notices an issue that is contributing to feelings of sadness, fear, or anger. When this happens while you're working as a peer navigator, It's important to acknowledge the feelings first and to temporarily put aside the issue so that you can pay attention to the present situation with your mentee. So here are those steps. So first, acknowledge that there's an issue that needs bracketing. You can say to yourself, I'm feeling sad or angry or whatever you're feeling because of what you are hearing. Identify what part of your own story is being triggered. Think, this is reminding me about, and then continue internal dialogue. You can say to yourself, I'm not going to relate to this experience right now. I will remain focused on the person in front of me. Make a contract with yourself to later remove the brackets and talk to personal supports that you might have. This can be informal friends that you might have who can support what you're going through, or more formal, like your supervisor. So you can say, when can I look at these feelings, and what or who will support me to do that? And throughout this process, just make sure to breathe. Debriefing is a process when a person is supported to reflect on what has happened to them in relation to a particular situation or period of time. It is in a safe place where the person can experience their own feelings and reactions without judgment in order to make sense of the current challenges. Here are 2 ways that we can debrief. First, you can check in with yourself about what you are experiencing physically, mentally, and emotionally. So after your one-on-one interactions with your mentee, like your weekly check-ins, notice any impact this has on you personally or any potential triggers. Some signs to look out for. Are you repeatedly replaying the situation in your mind? Are you feeling anxious, ungrounded, or not present after having those conversations? Second, it's important to establish a practice of talking to a trusted person about the impact of your work as a peer navigator on your own well-being. Informal debriefing is when you talk about a situation and have someone listen to you. It can be with peers or friends or other peer navigators in the study. So make sure to identify someone in your life who can help do this with you informally. It's also important to keep in mind that when you're sharing these experiences with friends or family, to make sure that you're protecting the privacy and confidentiality of your mentees. There's also formal debriefing, where you want to explore your current experiences more deeply with someone who can support you in your emotions and difficult questions. One of your supervisor's role will be to help you debrief and to support you emotionally as your peer navigator. So always be sure to feel comfortable that you can go to your supervisor if you're having any emotional problems as you are working as a peer navigator. There are also some other ways to practice self-care. So as I said before, let the study coordinators know if you are feeling frustrated or overwhelmed with a particular mentee or your workload. It's important to be able to share this with your study coordinator because their job is to help you. Make sure to turn your cell phone off after business hours. It seems like a small thing, but it can really make a difference. And make sure you set realistic goals. Provide information and support the best that you can. You're not perfect, nobody's perfect, so really just make sure that you're supporting people the best that you can. Nothing has to be perfect. And remember, taking part in this study as a peer navigator is an important contribution to the health of our community, and this is something that you can be really proud of.